Hello, everybody. Nice to see you all here today. I didn't realize I was going to be the master of ceremonies, but that seems to be my job. I'm Amy Satran. I'm Rick's daughter. And what we're going to do first on the program is we have a little iMovie that I put together. Since Rick was so interested in history, it seemed appropriate to start with a history of his life. I promise it's very short. People were not photographing every outfit and every sandwich in the 1930s and 40s, so we had less material to work with. But I thought it would give all of you who have known Rick at different times of his life and in different contexts a little summary of what his life was like. So thank you.
Welcome, everyone. I am not Rick Satran's son. People have mistaken I would be Neil right here. My name is Bob Holloway. I was a trainee of Dr. Satran's, and I'm the current chair of the Department of Neurology. And I welcome you all to celebrate the life and the career of Rick Satran, a truly remarkable man. I welcome Rick's family, who I've known throughout the years, Hilda, his children Amy and Neil, his brothers George and Leon, and grandson Roger. And I welcome all the friends and colleagues throughout the years, several of whom will be saying a few words to gently reflect on such a gentle soul. And as a husband, a father, friend, physician, mentor, teacher, and colleague, he meant so much to so many of us. He was the founding father, not just of the Department of Neurology, but literally all of neurology across the United States and the world. And he is a physician who lived and embraced the biopsychosocial model of medicine every day throughout his career, a model that is more important today than ever. Dr. Satran, as I mentioned, was always a mentor to me. When I arrived here in 1990, he was actually my attending in the resident clinic. And just last month in Washington, D.C., at our American Academy of Neurology meetings, we have our resident alumni reunion. It was amazing to reflect and hear all the residents talk on the influence that Dr. Satran had on them in their career. His calm approach to patient care, his passionate advocacy for quality of life in all its forms for all his patients and families, and his constant curiosity about the human condition and of neurology. His impact was far and wide. As we know, he loved the history of neurology and medicine, and I only thought it fitting to reflect back a little bit on the history. And on May 7th, on this very day in 1847, in Philadelphia, the National Medical Convention approved a resolution to establish the American Medical Association. It was 168 years ago to this very beautiful day that the AMA was born. The goals of this new AMA were to set the standards of medical education, to launch a program in medical ethics, to advance science, and to improve health. And Rick Satran embodied and effortlessly promoted all the ideals of the quality physician, mentor, and neurologist. It's only fitting that we celebrate his life and legacy on this beautiful day, 168 years to the day that the AMA was established. The AMA certainly would be very proud. And I would like to actually introduce some of his friends and colleagues to say a few words as well. And I think Fred Marshall, I think you're next. Fred is a well, you mentioned it.
Thank you. It's an honor to come to celebrate Rick's many, many amazing accomplishments and his life. That short film that Amy shared with us was very touching. I came to Rochester in 1994 as a young fellow straight out of residency, and within weeks felt like Dr. Satran had taken me under his wing. But I think everyone felt like Dr. Satran took them under his wing. I think Rick Satran came to me to represent someone who had a thorough, complete accommodation to who he was academically, professionally, and personally. He embodied neurology, and he loved it all the way to the bitter end. I had the I'll say, honor and burden of being his physician in his waning days as I direct the geriatric neurology clinics here and specialize in neurodegenerative disease. So to have experienced Rick in his full flower as a member of our department and as a loving teacher, and to walk with Hilda and Neil and Amy through his difficult last days was quite a touching thing for me as I think about his life. I actually refrained from looking at his CV until this morning because I wanted to somehow channel for you or convey to you the essence of the man rather than the details of his accomplishments. But I do want to share just some things from his CV that popped out at me. For example, the title of the very first paper that Dr. Satran ever published, which struck me as somehow evocative of his eclectic approach to this lovely discipline called neurology and neuroscience. I shared it with Bob earlier and got a little bit of a chuckle, but I have to sort through his CV to get it exactly right. Here it is, published in Neurology, Volume 11, 1961. His first author and sole author. Convulsions after ingestion of a plastic explosive. Is that not a wonderful first paper? He sort of exploded onto the scene. And as you already know from your program and from Bob's commentary, he became really, I think, the flame, if you will, the eternal flame of the history of neurology. He actually emerged over the course of more than a 50-year career in this field as the go-to person if you had a question about any aspect of neurology from its inception. He was a believer in eponyms, which I am. I don't like neuronal ceroid lipofuscinosis type 3 when Batten's disease will do. And he could have told you who Batten was, but he also could have told you who Turgenev was and who Chekhov was. He knew who Charcot was, and he had lectured at the Salpêtrière. He was inducted into historical societies of medicine and neurology, the Royal Society in England, in France, in the United States. He was honored for his deep and abiding love of the knowledge which neurology represents. And so I want to say just a couple of anecdotes that some colleagues shared with me about who Dr. Satran was, and share my own deep sense of his love of patient care. And little surprises along the way. How many of you knew that he had a master's degree in education from NYU? Hilda. He was an educator first and foremost. He educated us all, but when he came to Rochester after meeting Sandy Meyerowitz at Fort Bragg as a young captain, he came here on Sandy's advice because in part I think he was attracted to the promise of what Rochester held. He had studied with DeJong at Michigan, and he liked Bob Joint immensely and respected him and wanted to help build a department here that was strong. He also fit perfectly into what became the biopsychosocial model of medicine. I was talking with Rich Barbano this morning, and Rich shared that one of the things Dr. Satran loved to ask his trainees when they were presenting a patient was what the patient had had for breakfast this morning. Right? It tells you an immense amount about Rick Satran, that he knew people in a way that most doctors never bother finding out about them. He wanted always to put them in their context, to understand thoroughly who they were, where they had come from, what their desires were, what their pain was, how they had suffered, and what their life experience was. And so I think he embodied the biopsychosocial model of medicine and neurology here. I also want to say that another colleague shared that as Rick was kind of in his emeritus phase, it was a testimony to his love of our field that he always came to grand rounds. He never gave up his office. He considered himself an active member and was an active member of this department. And once the colleague in question said, "Rick, you're retired. What are you doing here? Why aren't you out golfing?" And of course, if you know Rick Satran, you know that he was here because this is what he loved first and foremost. He managed to reconcile his personal life and his private life and his academic life into one holistic chunk that was the real deal. And visiting him in his days as he struggled against his dementia, I can say that he still was a physician. He cared for everyone that he was with in the nursing facilities and wanted to round on them. You know, it was touching to see how he was called to be a healer and to be a doctor. And so I want to leave you with a short poem. It was written in 1911, in the late autumn of 1911. It's called "Memory is Not Enough." Memory is not enough. I do not recollect. What I am is alive in me because of you. I do not reinvent you at sadly cooled off places you have left behind. Even your absence is filled with your warmth and is more real than your not existing. Longing often meanders into vagueness. Why should I throw myself away when something in you may be touching me very lightly, like moonlight on a window seat? Thank you.
When Hilda asked me to speak briefly, she said briefly, I didn't know that I'd have tears in my eyes when I got up here, but I do. I first met Rick in 1962 when I was a first-year fellow in the Medical Psychiatric Liaison Group. I recall meeting him in the halls of the Department of Psychiatry and learning then of his work and his interest in the EEG. I was very impressed by his friendliness on our first contact and his comfort with someone who was working in medicine and psychiatry. At that time, I didn't know that he had a brother who was a psychoanalyst, and he came to Rochester because of Sandy Meyerowitz, as Dr. Marshall said. And Sandy was actually a new faculty member of the department, of the liaison group. My acquaintance with Rick was renewed when I came back to Rochester 6 years after my fellowship to join the liaison faculty. Part of my work involved a private practice in a general medical setting, and Rick was my favorite neurology consultant because he had an interest in the whole patient, as has also been spoken about here. And we would consult together and share observations about the psychosocial dimension of the patient's illness. I remember in particular a youngish mother of 4 children who had a progressive form of multiple sclerosis and a progressively stressful marriage. Rick and I often saw her at the same time in the same clinic setting in order to deal with her ups and downs. Another major interest of Rick was in the education of medical students in the biopsychosocial model, which Dr. Marshall also mentioned. He was especially interested in the students' ability to take a history, to really learn about the person, the setting of their life, their family, and their support system. As life would have it, Rick and I also came to share the same disease, atherosclerosis. Without going into details at this time, in the early 90s, Rick chose to follow the Dean Ornish lifestyle program in an effort to reduce his risk of further heart problems. He joined a group in which I was involved, and for more than 10 years we attended bi-weekly support sessions with a group of other men who were following this program. Another feature of the lifestyle program was eating a plant-based diet. For Rick, this was particularly courageous since he hated vegetables. And over the years, Connie, my wife Connie, Hilda, Rick, and I shared several restaurant meals together. Connie has frequently pointed out to me that when Rick would call our house, he would always take a minute to ask how she was. And then, when he found that out, he would then ask for me. As his dementia progressed, our time together and our conversations dwelt on these common topics of interest in our lives. In one of our last meetings, I brought with me the book by Jules Cohen on Engel and Romano. He focused right in on it, pictures, the topic, and spoke with ideas and memories and intense interest in this part of his history in Rochester. Rick's breadth of interest, his gentleness and humility, his equanimity made him a wonderful friend for over 50 years. Thank you.
Good afternoon, Hilda, Amy, Ray and Roger, Neil and Elizabeth, George and Leon, and all your family. It is an honor and a privilege and touching for me to share with you some of my memories of our dear friend and colleague, Dr. Richard Satran. Rick was the consultant who came to evaluate a 12-year-old girl on the old B4 at Strong when I was a pediatric resident. There were no pediatric neurologists then, so Rick, Wilbur Smith, and Alexandra Feldman examined the children. The young patient had a post-streptococcal neurologic illness called Sydenham's chorea, which was rare at the time. Rick was characteristically kind and gentle with the patient and a wonderful teacher for all of us on the house staff. That was the first time I met him. Rick was the complete and ideal physician. By that I mean he was an excellent clinician, teacher, consultant, and researcher. As a doctor, as already mentioned, he was interested in all aspects of his patient's life, and he taught about the importance of obtaining a careful history and including often omitted information such as a person's military service or their current living circumstances. He was concerned about what happened to his patients even when they left the hospital, and he encouraged young physicians to make realistic discharge plans. Rick talked about that almost to the very end of his life. It was that important. Teaching was important to him throughout his professional life, as we've heard. He served on the medical school admissions committee and also as dean of admissions for a number of years. As a man of great personal integrity, I have imagined that he observed the character of applicants, not just their academic record and achievements. In addition, Rick was very generous in supporting and educating his colleagues, those returning to practice after a medical leave or preparing for neurology boards. I recall one summer afternoon many, many years ago when Rick was reviewing neuroanatomy on our screened-in back porch with a group of psychiatrists preparing for their boards. I had to give him a kitchen knife to slice a brain to demonstrate anatomy. I could never use that knife again. Over the years, Rick contributed to the history of medicine, as you have heard. He researched and met the family of the French neurologists Klumpke and Desjardins in Switzerland. Desjardins' family was from Switzerland and elected to the French Historical Society for his extensive work in the history of neurology in France. He took Russian in his later years and was able to read Chekhov, a physician as well as an author and playwright, in the original Russian. He taught courses on Chekhov at Oasis for senior learning, and I was fortunate to be able to take his outstanding course on Chekhov's short stories. Rick was a great contributor and supporter of the George Corner History of Medicine Society, which met here in Rochester and in this very beautiful home. Also, he supported the Division of Medical Humanities and the Academy of Medicine. I recall serving with him on a number of committees here, which also met in this beautiful house. Charlie and I treasured our friendship with Hilda and Rick. We shared many memorable times together, enjoying cultural activities and delicious dinners. We observed their devotion to one another and the many interests that they shared. Rick was a loving husband, father, and grandfather. We all heard many Rogers stories over the years. And we also heard tales of growing up with his loved brothers, George and Leon, in the Bronx, not far from the Grand Concourse. Rick was a quiet man. One never knew all the things he had accomplished. For example, he volunteered for Lifespan and helped many people on their Medicare issues. I am still learning about many of his other professional and volunteer activities. Rick was a loyal and supportive friend. He would visit his friends when they became ill, and I am so glad that I was able to visit him during his final illness, and also to spend time with Hilda, who took such loving, wise, and deeply thoughtful care of him. By all of us whose lives Rick touched, he will always be remembered.
We all stand on the shoulder of giants, and Rick Satran was one of the true giants of neurology, medicine, and all of life. So I just want to end by simply thanking his family, Hilda, and everyone here for sharing Rick Satran with all of us, the Rochester community, the friends, the department, the medical community, for over 50 years, and allowing us to learn from a life so well lived and loved by so many. He was a neurologist, a physician, a father's father, and on, and his passion, integrity, and gentle approach to all he did will live on, I think, in all of us forever. If there's anyone who else would like to make a comment or two, we can certainly share comments. If not, we have a reception in the room. You want, Fred, did you want to say anything?
I was going to say some music, Finlandia.
Oh yeah, Finlandia, yes, by Sibelius, his favorite composer, actually.